Yeah, I would like you to say a word more about the health care issue. I'm a senior who really can't afford, I got a prescription yesterday, and when I went to get it, it was $100, and I don't have that much flex.
What had it been running?
What?
What had been the cost of it before $100?
I have no idea. The man told me that my supplemental insurance was paying half of it, so obviously the cost was $200.
Right.
But I don't understand how we're supposed to make it.
Yeah.
It's so people talk like Medicare covers everything, and it's not even close.
You're absolutely right. And when I ask people that question, how do you cover it if your prescription copay amounts to $10,000 a year? Folks tell me that they don't pay for it. They can't make it. They're rationing their medications. They're supposed to take 3 of those pills a day, and maybe they take 1, some days 2, just to see if they can stretch it out so that they can make ends meet in their household. This is what happens when we do not allow Medicare to bargain with the drug companies to bring down the cost of our medications. This is what happens when by law we don't allow you to buy your prescription medications from Canada or the European Union or other countries where they're sold far less expensively than they are here in the United States. In our administration, Medicare will use its leverage and its purchasing power to bring down the price of those medications. We will also use the investment that you and I make as taxpayers in the initial research and innovation and the clinical trials to make sure that those medications are affordable when they are then sold back to us. You will also be able to buy across international boundaries and across the Atlantic Ocean if you can find those medications for cheaper. And then, as we said earlier, universal, guaranteed, high-quality health care. The operative word for me is guaranteed. Having health insurance alone doesn't guarantee you anything if you cannot afford the copay. So I'm going to guarantee that you can afford those medications that improve your quality of life, or those medications for example, diabetics, insulin, that literally keep them alive in a country where right now folks are crowdfunding their insulin treatment 97 years after it was invented and sold to the Canadian government for $3 Canadian. Why are people making millions of dollars in profit off of selling insulin today, more than a century later? So yes, we're going to guarantee your health care and your ability to be well enough to do whatever you're placed on this planet to do in the first place. Thanks for asking. Appreciate it.